The main arguments against privatization of the NHS, safeguarding healthcare for all. Introduction. The National Health Service, NHS, in the United Kingdom has long been a symbol of accessible and universal healthcare. However, the prospect of privatization has sparked intense debates and concerns regarding the potential impact on the quality, equity, and affordability of healthcare services. This essay aims to explore the main arguments against the privatization of the NHS, emphasizing the need to safeguard healthcare for all citizens. Threat to universal access. One of the primary concerns raised against privatization is the threat it poses to the principle of universal access to healthcare. Privatization may result in a two-tier system where access to quality healthcare is determined by an individual's ability to pay. This could leave vulnerable populations, such as low-income individuals and those with pre-existing conditions, at a disadvantage, exacerbating health inequalities. Profit motives over patient care. Critics argue that privatization introduces profit motives into the healthcare system, potentially compromising patient care. Private companies may prioritize financial gains over the provision of comprehensive and patient-centered care, leading to cost-cutting measures, reduced staffing levels, and limited services. The pursuit of profits may undermine the primary mission of healthcare, which is to prioritize patient well-being. Fragmentation and coordination challenges. Privatization can lead to fragmentation within the healthcare system as various providers compete for contracts and services. This fragmentation may result in coordination challenges and a lack of continuity of care. For instance, multiple private providers may struggle to share patient information effectively, leading to fragmented treatment plans and potential medical errors. Increased costs. Contrary to the promises of cost-effectiveness, privatization can lead to increased healthcare costs. Private providers may prioritize profit margins, leading to higher fees and charges for services. Additionally, the introduction of market competition can result in duplicated administrative costs and a more complex billing system, adding financial burden to both patients and the healthcare system. Lack of public accountability. The privatization of the NHS raises concerns about the loss of public accountability. Private companies are primarily accountable to their shareholders, which may conflict with the broader public interest of providing affordable and equitable healthcare. With privatization, decisions regarding service provision, resource allocation, and quality standards may be driven by profit motives rather than the needs and values of the population. Potential for privilege and exclusion. Privatization can exacerbate social and economic inequalities in accessing healthcare. Private providers may focus on profitable services and locations, potentially leaving underserved communities and rural areas with limited access to care. Furthermore, private insurance schemes could create a system where those with better financial means can afford more comprehensive coverage, leaving marginalized populations with limited options. Loss of professional autonomy. Privatization may impact the professional autonomy of healthcare practitioners, particularly in terms of decision-making and treatment options. Private providers may impose restrictions on doctors' clinical autonomy based on financial considerations, potentially compromising the doctor-patient relationship and the ability to prioritize patient needs above financial interests. Threat to NHS values and ethos. The NHS has long embodied core values such as solidarity, equity, and collective responsibility. Critics argue that privatization undermines these values, shifting the focus towards individualism, profit, and market-driven principles. The loss of these values and the erosion of the NHS's ethos may fundamentally alter the healthcare system's identity and its ability to provide comprehensive and compassionate care to all citizens. Conclusion. The arguments against the privatization of the NHS highlight the potential threats to universal access, patient care, affordability, and the core values of the healthcare system. The pursuit of profit in a privatized system may compromise the principle of healthcare as a public good, leaving vulnerable populations at a disadvantage. While acknowledging the need for efficient healthcare,